Good afternoon and welcome to this hybrid meeting of Social Services, Housing and Community Safety Scrutiny Committee on the 1st of May 2025. I am Councillor Charlotte Goldsworthy and I will be chairing this meeting. Bear with me. Before we move on to the next agenda item, I would just like to say, obviously, with the sudden passing of one of our fellow councillors, Peter Richards, we all, I think, send our condolences to Denise and the children, and I think he's going to be a great loss from this committee. He's already been missed by many of us, as you'll appreciate, because he was the person that we went to because of his experience and the length of time that he's been and the different roles he's had in social services. So I know that we'll be doing a minute silence in full council for him as well. Okay. Back to the agenda. This meeting will be recorded. Please can you ensure that all your phones are switched to silent for the duration of the meeting. Can members and officers who are present in the chamber please use their microphones when speaking. When asked to raise your hands, can members who are virtually viewing this meeting raise your electronic hands, and members in the chamber raise your physical hand. For those members virtually viewing this meeting, please can you keep the chat function for urgent IT issues and not for questions and comments. I wish to remind members signing in remotely of their legal obligation to have their cameras switched on during the meeting, please, in order to be seen and heard while participating in council business. I will move straight on to agenda item 2. Are there any declarations of interest today?
I can see no declarations, Chair.
Agenda item 3, you will see the minutes attached at pages 5 to 18 of your agenda pack. If you feel these minutes are an accurate record of the meeting, I will propose, can I have a seconder, please?
I'll second.
If members do not indicate to the contrary, then I will take it that these minutes are approved.
Chair, there's no indication to the contrary, so those minutes are approved.
Agenda item 4. Now we will consider items from the Cabinet Work Programme. Straight on to agenda item 4A. This report is for monitoring only, and it's for the Healthy Relationships for Stronger Community Strategy. Please can officers provide a brief introduction to the report, please?
Thank you, Chair. So back in 2023, we published our third Healthy Relationships for Stronger Communities strategy, which is a joint local strategy with Swansea Bay University Health Board. And that sets out what steps that we as a council and other partners like the third sector, the health service, will take in order to meet the requirements of the Violence Against Women, Domestic Abuse and Sexual Violence Act 2015. So within the strategy, we have 7 objectives. One is communications and engagement in order to be able to increase awareness and challenge attitudes towards violence against women, domestic abuse and sexual violence. We also have an action around children and young people to increase awareness in children and young people of the importance to feel safe and being safe relationships where they feel equal partners and have healthy relationships, and that abuse behaviour is always wrong. We have an action around perpetrators to increase focus on holding perpetrators to account and also to be able to provide opportunities to perpetrators to change their behaviour based on victim safety. We have early intervention and prevention to make sure that that is a priority through everything we do. We have an action around training so that relevant professionals are trained to provide effective, timely and appropriate responses to victims. We also want to focus on accessibility of services so that victims have equal access to appropriately resourced services within Neath, Talbot. And then a final one, which is around having an increased focus on the courts and criminal justice system and recognising and improving recognition and responses to violence against women, domestic abuse and sexual violence in all criminal justice proceedings. So the report before you today is an overview of what we said we would do and what progress we have made against achieving those actions. So what I am going to do is just hand over to Eleanor and Lisa, who are just going to do a quick presentation to give you some of the highlights in this report.
Thank you, Shelley. So Lisa's going to go through some slides which will demonstrate the progress made in the first year of this strategy. So I think it's just important for our members to keep in mind there are another 2 years after this that we need to report on. So there's an awful lot contained in the strategy, but what we want to cover today is progress between 23 and 24 on each of the objectives. As Shelley has touched upon, they do mirror what's in the national strategy to make it easier for us to report on and what they're looking for at a Welsh Government level. We do have some resource that comes into the council from Welsh Government, but obviously there's some core funding that goes into this work as well. But I think one of the things to keep in mind really is that this is very much a partnership effort. So whilst it might be a statutory duty on us and on the Health Board, our role really is to coordinate our partners to bring them together to help us deliver on this and hopefully have a positive impact on the victims living in our communities to help them come forward, be safer. And of course, our team are there to really try and pull that together and help. So I'll hand over to Lisa. She'll go through some slides and then we can take some questions. Thank you.
Okay, thank you. So as should be appearing on the screen now, this annual report then was prepared throughout 2024 and finalised in January of this year, made up of contributions from our partner organisations. We've signed off by our colleagues in the Health Board and is obviously brought before you today. So the purpose of the report is to review the objectives of our Healthy Relationships for Stronger Communities strategy, which we launched back in 2023, and examine which of the actions have been achieved so far. The structure of the report will follow the objectives of the Healthy Relationships strategy, and this summary is just a whistle stop. It's kind of a brief outline of some of the work being undertaken, rather than running through all 28 pages of the report. So we come to the first objective, which is around communications and engagement. This sits within a regional subgroup, which meets quarterly. The agenda usually follows the annual events calendar in order to discuss the upcoming campaigns and plan our forward work programmes. The purpose of this subgroup is to increase the reports of violence against women, domestic abuse and sexual violence in Neath, Talbot through awareness raising and challenging attitudes. The way we do this is through various campaigns, awareness raising events, and examples should be appearing on the screen. Things like our Heads Up campaign. So this was an initiative where we were educating staff in the hair and beauty industry to spot signs of domestic abuse, to know what services were available locally and nationally, and how they can signpost clients to access support. During 2023-24, this initiative was extended and incorporated the South Wales Police Operation Prunella alongside some of our social services teams, and we extended it further then across the region. Both those teams also supported the expansion of our Safe Spaces initiative, which now includes all civic buildings and libraries across Neath Talbot, as well as retail premises in the town centre. So if anyone is feeling unsafe in any of those areas, they can access those buildings for safety. White Ribbon is our annual campaign providing a huge opportunity to promote services to end male violence against women. As ever, our partnership event at Neath Talbot Hospital works really well to raise awareness among staff there as well as patients, and this is accompanied by a social media campaign over the 16 days of action that follow the White Ribbon Day. In 2023, the Safe Neath Talbot social media platform had a reach of around 21,000 people during this period. Try and change. Next, we come to the children and young people objective. So relationship and sexuality education is a key element to promoting healthy relationships to young people. And the children and young person subgroup has been instrumental in the rollout of lessons. Age appropriate healthy relationship lessons are delivered, or were delivered, sorry, to over 2,200 pupils in schools and the college through our partnerships with CAMI Training and Stories Spectrum Project. Over 1,500 pupils who visited our Crucial Crewing event engaged in a healthy relationships workshop as part of that event. Carlin DVS supported 29 children and young people through its refuge service and 92 children and young people through their R-Track project. We do continue to explore methods of tackling misogyny and promoting positive use of language and behaviours through various partnerships across health and education, obviously recognising that early intervention with young men and boys is key in addressing those issues. Next, we're looking at our perpetrator work. So work with perpetrators is a key part of the strategy and is something we are keen to explore further in Neath Talbot. The DRIVE project, introduced in 2020, continues to work with high-risk perpetrators of domestic abuse. Thrive Women's Aid, or Thrive Domestic Abuse Services, as they recently changed their name, are able to offer their CLEAR programme, which works with lower level perpetrators, and Callan DVS offers the Inspiring Family Service, with a whole family approach to work with families who wish to stay together. Callan also, through their Rep Provide programme, were able to trial a group intervention to help males who are violent or abusive to their partners. So with regards to early intervention and prevention, the Health IDVA we have established at Morrison Hospital continues to offer support and signposting to victims. We've got the Irish programme, which provides training to GP practice staff to enable them to identify and refer on any patients who make a disclosure of domestic abuse. This has quickly demonstrated its value, with over 204 clinician referrals being made since its rollout, compared with just 9 referrals in the previous 2 years before its introduction. At the moment, over 450 GP practice staff have now received the Irish training delivered by Callan DVS across this region. We've also had the Compass project offered by New Pathways, which provides early intervention and prevention of harmful sexual behaviour, aiming to stop these behaviours escalating to the level where significant harms are caused. For the training objective, under the National Training Framework, Group 1 is the basic mandatory awareness training for all staff working in public service. We've got some fantastic levels of training undertaken across Swansea Bay, with over 92% of Neath Talbot staff and 80% of the Swansea Bay Health Board staff having now completed that Group 1 training. Group 3 is Workplace Champions training, and that continues its rollout across the region, with Neath Talbot Council now having 14 champions and the Health Board training up 43 champions during 23-24. As an aside to that, we're also looking at a big drive on White Ribbon Ambassadors for the coming year ahead. We've got big support from Noel and Daniel, who's keen to promote that kind of awareness among staff as part of our White Ribbon campaign. Accessible support services. So lots of work's been undertaken under this objective with regards to the MARAC, the Multi-Agency Risk Assessment Conference, primarily with the introduction of a new MANTA IT system, which is a purpose-built communications and action planner to support the actions to reduce risk. This has helped really take a step towards making the MARAC process a really more streamlined and efficient service. MARACs are held weekly, often with 30 or more cases to discuss, so it's really important that this is as efficient as possible. Callan DVS have been awarded capital funding to purchase a property in Neath Talbot that would support victims who weren't suited to a female refuge. Their property can now be offered as a dedicated male refuge. They also offer a male IDVA, Independent Domestic Violence Advisor, and their Compass programme for male victims of domestic abuse. A multi-agency review into social services response to cases of domestic abuse was undertaken throughout 2023, and an action plan has been prepared for implementation from 24-25. The local service providers have also been developing services to extend their current provision. This includes services for victims exploited by the sex industry. So Thrive's Swan project provides support to women who are exploited by the sex industry, offering a flexible, non-judgmental service through one-to-one appointments, outreach provision and crisis support. Myriad programme offered by Callan DVS provides an 8-week recovery and resilience programme designed specifically for LGBTQ+ survivors of domestic abuse. And then victims of sexual violence and abuse. New Pathways provided one-to-one specialist sexual violence support to over 650 people across the Neath Talbot region, offering a range of support services. Work was also continuing on Callan's first Sexual Trauma and Recovery Centre. The doors officially due to open in autumn-winter 2024. They actually opened in February of this year during Sexual Abuse and Sexual Violence Awareness Week, and we were lucky enough to visit, and it really is a fantastic facility. Finally then, our criminal justice objective. So the Regional Specialist Domestic Abuse Court Steering Group continues to meet, bringing together local partners across the criminal justice system to ensure there's a joined up response to domestic abuse. Our IDVA service, the Independent Domestic Violence Advocacy Service, continues to work closely with the regional court IDVA to improve outcomes and experiences for victims and reduce the number of repeat victims. And Thrive also delivers domestic abuse training to our police officers through their RAPID project and provided awareness sessions to local magistrates. In addition, they offered legal sessions with solicitors to Thrive service users on their site at Thrive's office. So next steps, as I said, this is just a brief outline of some of the work we've been undertaken in 2023-24. The full details are available in that full report. The work of the Vowder SV Leadership Group remains a key priority area for the local authority and the Community Safety Partnership Board. We continue to ensure that our local objectives align with those of the Wales National Vowder SV Strategy. We continue to support the National Vowder SV Blueprint model, contributing and sharing information where relevant. And we held a leadership group development day in 2024. And one of the themes that came out of that was that in Neath Talbot, we are really proud of the strong partnerships between our statutory, voluntary and third sector agencies. And it's really important we ensure we will maintain and those partnerships to deliver those objectives we've outlined. So finally, I hope this has managed to capture a bit of a snapshot of some of the work undertaken for 23-24 by the specialist services, demonstrating the importance of this strategy really in fostering a safer and healthier community. Thank you. So open to any comments or questions.
Thank you for that.
Lisa, if you just turn the mic off, please. Thank you.
But firstly, I think congratulations is in order because it is an excellent report and the figures are fantastic. And in fairness, I think it's the group that I actually see out and about around the town on social media 7 days a week, in fairness, whether it's Paw Patrol or wherever, it's there and it's fantastic. And I would say that the team is so approachable and you're dedicated and you're very passionate about what you do. So I think, I think we all want to say a big thank you for that. Again, there was the questions, obviously work in partnership and that. So one of the questions was about the scrutiny. What do we do as a scrutiny to ensure obviously that the partners are delivering what they say they're delivering, and obviously the figures that they obviously give are accurate as well. I do like the fact of there's going to be a lot more focus on perpetrators as well going forward. So again, I think we look at that going forward as well, and we can look at putting that a bit on the forward work programme as well in future, and maybe some of it we might have to go into private, if that would be okay, to discuss further cases. So to have more examples about, the sort of impact that the work is doing and the next stage forward. And I think Helen has a question.
Yeah, my only question was about they've bought the dedicated male refuge. What are we doing for transgender people?
Well, I can go through those questions. So starting with, I think the first question was around how do we make sure providers are doing what we've asked them to deliver. Then with regards to that, we have our commissioning team. So the services that we commission in respect of domestic abuse are predominantly funded by housing support grants. So Hayley's team, Hayley Short and her team, undertake a lot of work in terms of monitoring services, monitoring impact, monitoring outcomes. There's a lot of outcome data that providers need to provide us, and information and stats in terms of things like things in terms of numbers of people coming into services. There's physical monitoring visits and data constantly coming through. So that is very robustly managed by the commissioning team. And then there was a question in respect of transgender community and what services we support are there. So there's a range of different services that we commission directly, including floating support, so people will be able to access floating support, things like that. It'll depend on what that transgender person needs, essentially. So if somebody comes into service needing a service, their needs will be assessed and the appropriate services provided to that person in the same way as anybody else.
Yeah, it's just my concern was, I mean, obviously this court decision thing. You know, I assume previously we would have put transgender women in a women's refuge if they needed it. What's the situation now? Because obviously we don't want to put them in a male refuge, do we?
We don't have an updated position on that. So I think there is some statutory guidance being drafted around that. We do not directly place people into provision. That is done through a national helpline. So with regards to transgender people, when somebody rings up, somebody will take that call, they will do an assessment and place that person in safety in a place that's appropriate to their needs.
Do you want to come back or no? Fine. Yeah, okay. So thank you for that. Any further questions? I don't see any. Just bear with me. Okay, sorry, there were further questions. You just thought you were off lightly then, didn't you? I know. Could we have briefing now to explain to people, because we have briefing 2 days before, and we also have another briefing an hour before. So obviously members who are working in that can come. Sometimes I can get sort of, because I've had maybe the answers there, I forget to actually ask the questions in the main meeting. So bear with me. But right, okay. So we've said about obviously more information on perpetrators going forward. The other thing is the impact on the training, because obviously a lot of it has had the figures are down to how many people have been trained, whether it's in the hospital, GP surgeries, etc. Is there any further information that we can require as in the impact that it's actually having? Now, we've seen 204, I think it was, from memory, and that's a phenomenal number compared to the 9. And again, it's more information like that. I know that myself and members obviously would like to see, and the impact now, obviously you work up until now and going forward is a lot more on the impact of things. So any sort of casework or things like that, and we can discuss that in the forward work programme with staff about how we take that forward. What engagement has there been on the strategy with survivor groups that ensures the strategy meets the needs of its supports? Should we ask one at a time? Yeah, go on. Go on. I'll give it to you easier.
Okay, so with the consultation, when we first launched the strategy going back to 2023, it was subject to a public consultation at that time. So we made sure, obviously, with the leadership group to develop the strategy in partnership and work with some key focus groups through our third sector specialist providers, and also through people that have come through our IDVA service as well. So the IDVA team is specifically for the high risk victims, those at risk of serious harm. So it's really important we get feedback from a cross-section really of people to know how we're meant to shape our services going forward. Survivors' voice is really key, isn't it, into shaping things. They are the best people to tell us what was missing, what stopped them from coming forward, what could have been better. And we continuously make sure that we've got survivor involvement in various bits and pieces of our work, whether that's the communication and engagement group sometimes. A prime example, we've got a domestic homicide review ongoing at the moment, and the family of the victim actually came to the panel meeting on Tuesday of this week to meet with the professionals who are going to be responsible for looking at the learning from that individual case, what happened in the lady's life. So things like that are really important to us to help us shape what we do going forward. And that's not just for us as a council, that's for everybody that's involved in this work, whether it's health, police, whether it is the providers themselves. So it's a bit of a continuous exercise. There are probably areas of our work we could involve survivors a bit more, but we do appreciate it can be quite difficult for people as well to come into sometimes a room full of people talking about plans and to have to give you a personal story. So there's ways in which, with the support of Welsh Women's Aid, we can try and integrate that more into what we do. But when we come to look at a revised version of this strategy the year after next, we'll do exactly the same again.
Yeah, that's great. Given a recent survey with Neath Talbot, and I know that we're obviously not in the environment department by here now, we're actually in social services, but obviously, you know, how do the plans for the light dimming across the borough align with the strategy? Obviously, you know, for the young girls, and not just girls, but young boys as well, walking home from work, etc. So, how's that align with the strategy?
Yeah, thanks. So Steve Owen, who I think is the lead officer leading this pilot, he has really engaged with us incredibly well. He attended our Community Safety Partnership board meeting and our Valdor SV leadership group as well to talk to us about the proposed, it was then a proposed pilot, what was going on, why, to try and why they were doing it, and also to hear from the stakeholders, because the right people were around the room to kind of give some initial feedback on how that pilot might be implemented and anything that they'd need to be aware of. So he really engaged with the partners. He also actually met with Thrive Women's Aid as well separately and did a lot of work with them. So he did a lot of work there prior to even starting that pilot. And then also we were given a list of the areas so that we could check those street names against our database to make sure there wasn't any high risk individuals living there, any victims or anything like that. So they were really robust with that. And then essentially with it as well, we are collecting data to feed into their evaluations. So the data we collect in terms of incidents, things like that, will directly be fed back and part of that evaluation. And then as well, he is going to come back to the Valdor SV leadership group and the Community Safety Partnership Board once it's all completed to kind of give an overview of those results and everything like that. But at this point in time, we aren't seeing any notable concerns in the area that this has been rolled out.
Thank you. Councillor Prigad?
Can I just ask, Shelley, are we looking at the elderly in that demographic group?
Sorry, Shelley. Oh, thanks.
Sorry,
Yeah.
I don't have wider information about the pilot, just the bit where he's engaged with us in regards to Valdor SV. So I wouldn't be able to answer that question on behalf of Steve.
I just think it's important that we don't forget the elderly, because a lot of our wards are made up of elderly people. With
Yeah,
obviously
and I
visual
would second
problems.
that one. But obviously this is specific to the Brenson's women and that. But you raise a valid point, because that's exactly what I was thinking, because what my own ward was a pilot area, and the actual streets that they used basically was more older people. So I think that's something else we'll address obviously outside of this meeting. Yeah. This bystander training available to officers who deal with the general public. So can you explain to members what bystander training is, and is it actually available to all staff or just front-facing staff?
Okay, so there was a national campaign from a Welsh Government level about don't be a bystander, so that if you were to see something, whether it was in public or in your place of work, that you wouldn't be a bystander in the national training framework that Lisa has covered. So all staff will have that training at level 1, and then depending on your individual role will depend on the type of training that you get. So for example, level 6 of the training would be for our senior leadership team. There's a particular level of the training that's appropriate for members, and then there'll be training for people with customer services staff and that type of thing. But there are always, aside from what we would offer as part of that standard training programme, there will be the occasional bystander training that's offered from a specialist provider or a local service. So we then would look at promoting that into the right teams, or maybe on Viva Engage or through our internal comms team. And again, we get a lot of take up from members of the public as well who want to be invested in supporting people in this type of work. We had some Ask Me champions through our specialist providers as well, so people in the community that you could signpost them to if they needed additional help or support. So there's plenty on offer. It's just about making sure that the right people know about it at the right times, isn't it?
Interesting. Obviously, it's just come to my mind now because it's general public. So if you look at downstairs, it was used to be open. So obviously, if you know, like you're saying about a bystander and that, on the entrance, they've actually taken away the entire view from the front desk to the main door. So say, for instance, something was happening or something is about to happen, they've actually taken the visual view from someone coming in, whether it's irate or something happening with the couple or that away. And, you know, was that the right sort of decision made there to obviously, you know, rather than just put in glass screens there, so you see the entire view coming in to the public, and for the protection of our own staff too. I think that was a bad choice myself, but I don't think that's for this committee either. But I thought I'd mention it because it's things that when you read papers, you actually start thinking different about how things could happen. So there couldn't be any bystanders there, whether they had training or not, if it's obviously happened behind the wall. So there. And the final question is, the UK government has announced that North Wales will be launching a pilot on domestic abuse protection orders. Does Neath Talbot have an interest in looking at any similar programmes?
Sounds interesting. We are keeping an eye on it. So it is something that we might potentially want to look at later down the line. But essentially, at the moment, we're just waiting for a steer from the Police and Crime Commissioner's Office on any potential pilots in the South Wales Police Force area. So, but it's something that we're looking at and we're aware of.
Yep. Okay. Any further questions? And the main screen has gone off. Just bear with us a moment. I didn't notice that.
Yeah, that screen is working. I've checked on Teams. The Teams meeting is still running. I've asked for assistance regarding the screens, but I'm just checking with members at home that they can still see and hear us. Okay.
Give me 2 minutes to get my iPad a minute because I can't see anyone if they got their hands up at home. Bear with me.
Can I just check with members at home? Can you see and hear us okay in the chamber? Yeah, I'm getting thumbs up from you all. Thank you. We can't see you at the moment. So if you just bear with us and we'll be back with you very shortly. Thank you.
That's it. I'm back. I can see you all now. Right. Okay. Right. So thank you, everyone. And we will now move on to agenda item 5. There are no scrutiny committee forward work programmes items for consideration. And now we will be going on to agenda item 6, which is the performance monitoring reports. Yeah. Right, okay. I don't know where to look at the moment because I'm so used to looking now. Do you know what I mean? That's okay. Right. The only one observation that we've actually seen on this one, obviously, we'll go straight into the briefing there as well, obviously, and I think we got a question there, was just the font being used. And obviously, if it could just be in line with the usual font for obviously reports that we read. Yeah.
Yeah, thanks, Chair. So this is the Social Services Complaints and Representations annual report. I have the officer who oversees this, the collation of this report online, Leighton Jones. I don't know whether he wants to do any introduction. I think the report is pretty self-explanatory. As you say, we can't actually see there, but I don't know whether Leighton wanted to come in at this stage.
There's nothing specific to report, Andrew. I trust that members have read the report, but happy to take questions if necessary.
There's only one question, because in fairness, Leighton, I think members will agree it's very detailed, very straightforward report. But I will go to Councillor Freegard, please.
It's just one question, Leighton. I was just wondering, on page 80 on table 2, I wondered if we had any benchmarking data.
Apologies. When you say benchmarking data, is that
As with other authorities?
Other authorities?
Yeah.
Unfortunately not, Councillor. What tends to happen, the Ombudsman will report on complaints, but as a council, not drill down to social services.
Right.
But I do have anecdotal, because clearly I speak with colleagues across the region, and our numbers are relatively low. So I won't name names, but one neighbouring authority would be in the hundreds as far as what they are dealing with. And a brief explanation around that. I think it's because the complaints, or when people make representations, that the service, along with the complaints team, deal with those quite quickly, because we do have an opportunity to deal with complaints informally before they get to the formal stage. So I think that is a little bit of an explanation as to the numbers.
Thank you, Chair.
Oliver Davis.
Thank you, Chair. Just skipping forward slightly to agenda item 6B. Page 97, percentage of households successfully prevented from becoming homeless. Now,
Wait there, we're actually on 6A at the moment, all
right, call me back.
I'll call you back in a minute. Again, thank you for that, Leighton. This one was for noting only. So Ollie being excited there. I'll move on to 6B. Bear with me. Again, this report is for monitoring, and it is the social services performance data. So anything to add, or will we just go straight into questions?
Happy to go straight to questions, Chair.
Right, can I come in now, Chair?
Yeah, sorry, I didn't press my button. I can't see the screen.
Thank you for that. Right, looking at page 89, percentage of homes successfully prevented from becoming homeless. Now, the figures December 1921 to September 1923, the figures are all in the 60s and 70s. If you go from March 1924, the figures are in the 30s. Is there any data why the numbers have dropped on that year? Have we got the properties, or is there still people waiting? Because I said, the numbers that we prevented are almost dropped by half in 2 years.
I'll bring Shelley in now.
Thank you. So in these two tables, the graph, you can see that we have prevented more people over this last year from becoming homeless than we have in previous years. So with regards to that first graph data, that KPI essentially shows something which is called the number of people that are owed a statutory Section 66 duty that are then prevented from becoming homeless. And the reason why we provide that stat is that's something that we have to provide to Welsh Government, okay? So essentially, what happens is when somebody is notified that they are about to become homeless, the landlord might give them an eviction notice, something like that. When they're 56 days away from becoming homeless, local authorities have a statutory duty to help prevent that household from becoming homeless. So we have prevented more people that are owed a statutory duty for homelessness from becoming homeless. So that's why you can see that the stats are a positive thing in terms of the percentage. If you look at the table below, like you say, you'll see that we've moved from 60, 40 people to 30 people. And the reason for that is now with our new restructure that we put in place, our new ways of working, what we're doing is we're working with people at a much earlier stage in their journey. So there was a change in legislation, I think December 2022, I want to say, where people had to be given 6 months notice in most cases for their, from their landlord. So people were aware much earlier on that they are potentially at risk of becoming homeless. So we get people ringing us up earlier on in that stage, and we made a decision to not wait until people were owed a statutory duty. We decided we would start work with people at an earlier stage. So we're actually stopping people from actually requiring a statutory Section 66 duty. So Emma's actually doing some work around this at the moment, and we are wanting, with your permission, to present a report on the prevention work that we're doing, because we're doing a lot of prevention work that isn't reported in these two KPIs. Emma, is there anything you wanted to add?
Sorry, Emma, can you just put the mic on so the members at home can hear?
Yeah, just saying all that to everything. She's covered everything, and like she said, I've started working on a paper. We're focusing a lot on the early intervention work, so that is potentially 4 or 5 months before somebody gets to a point of being owed the statutory duty, and we'll bring that back to you then at a later date.
I can't see any. Oh, Councillor Freegard.
Thanks, Chair. Yeah, first of all, I'd like to say thank you for the data that's been provided here. It's exactly what we've been asking for, particularly on measure 6, page 102. And it is quite alarming to see the increase in the emotional abuse. So going forward, it's good to have this data for members so that we can keep an eye on how things are going. But I was going to ask if you could just provide some clarity around. I can see that we got a dip in January to March there. Or it's 23, is it? Up there? I can see we go down to 43. But I was just wondering, on the following pages of 104, you've got re-registration on the Child Protection Register. So we've got there 22, 23, and I can see we got one re-registered there. So I would take it that they were all they were new to social services. Yeah, that's otherwise they didn't come off the register and go back on. So they were all new. Is that the case? They'd have been new, yeah.
Is there?
Yeah, I mean, Chris Frey can answer that, but I'm happy to say so. So just quickly before I ask Chris to answer, so it won't be new to social services. They might be new to the register, and that's the difference. But Chris will be able to tell you that in more detail.
But thank you for that. I
Speaking to your mic.
Oh,
Sorry, Councillor Freegard, your mic's gone off.
I was just saying thank you for the data. It's really useful. So I hope we continue to have that. Thanks very much.
Yep.
Yes, Chris might have something that he wants to
Chris,
say.
you want to come in?
Yeah, I think just to clarify, so that the re-registration data reflects those children that have previously been on the register and have had another period of registration, so are re-registered. That's what that data relates to.
Thank you. Any other members got any questions? Yeah, go on.
Yeah, I just wanted to ask about the measure 2, the DFGs. Says the average number of days to deliver it from first point of contact to certification. Do we have any statistics on how long it is till the first point of contact is?
Oh, sorry, you mean how? So first point of contact. Sorry, what do you mean?
Is this first point of contact the first time you contact them to do an assessment, or is it when they phone in to say they want to have it?
Thank you for the clarity. I think Rob is online. Rob, could you take this one?
Yeah, of course, it's the first point of contact that them to us, as in the authority, when they contact the authority.
Yeah, in fairness, I thought they were excellent figures, considering that I thought that it was a 3-year waiting list, so that has come down tremendously, that has. The other question that was asked earlier, because I'm going to start asking some questions that were members, but they've had to leave. So you'll have to bear with me a minute. But in regards to urgent cases, if, say, for instance, people are stuck upstairs or, things like that, How do we, is there a priority system in place? How does that work?
Yes, there is. The OT officers will notify us if there's a priority need, if there's a priority case, and then we will look at that as a priority. That will basically jump the queue, jump the waiting list, and it'll be dealt with immediately.
Brilliant. Is there any other questions? I've got other questions. Sorry, I'm going to go back to my pad now. That's that one done. Heath, if I bring you in here.
I'm sorry, I've been wide awake at 2 a.m. in the morning. Is there a fast tracking intake increase in numbers? Is there a reason for this? Sorry if I haven't answered this right. Does it make any sense?
Yeah, do you mean obviously with looking at the chart, obviously it's gone lower, which I'm assuming is COVID, and then obviously it's gone from 10,000 to 11,138. So obviously, is that Angela coming in to? Angela's on the call?
I am, Chair. Are we talking about the domiciliary?
We can't hear you, Angela. Yeah, if I go to Council, I'll unlock you for a question as well. Whilst Angela's putting her headset on.
Okay, yeah. Actually, it was back on measure 2 for the disabled facility grant. It's a case of I think you more or less answered actually, Rob, in that I was wondering if it was a new case and they needed any backup or facilities, whether that be physical or whatever, whether that would be rushed through, because I mean 410 days is quite a long time if someone's got a severe disability problem. But I mean, if it's a case of where they've suddenly found themselves in this situation due to an accident or whatever it might be, is that prioritised? And I think you may have answered that. I don't know.
Yeah, it's very similar to the previous answer, really. The OT will make that judgment. They're the ones that are medically trained for it. They will then advise us who needs the urgent care, because we have an awful lot of cases that are all in a fairly urgent position, should we say. So it's the most urgent of the urgent will come through for priority need. Yes, the 410 days, I think that's reflective of what has happened the last couple of years with the means test being removed, which we brought to paper back a couple of times. We've now brought back in that means test. So now that should reduce the demand on our waiting list, and we expect to see that time coming down quite rapidly over the next year, 18 months.
Oh, great. Thanks. That's good news. Thanks, Rob.
Is that okay, Al? Right, okay. I'm going to be asking the next question now. Yeah, Angela? Can you hear me, Ange? Angela's frozen, is she? And my mic's on. Ange?
Yeah, can you hear me now, Chair?
Yeah, can hear you now.
Sorry, so was the question in relation to the number of domiciliary hours that have gone up? Yeah. So just so you're aware, so as I've said in prior meetings, this isn't a completed article yet. So what we have is an in-house service that right sizes packages of care before we move them out to the external market. What you will see further down the line this year is when Tremaglin is up and running, that is our new reablement offer, we will be measuring the number of hours of domiciliary care that are declining as a result of us reabling people quicker, and the number of people who are not entering residential care as a result of us being able to reable them back to their own home. So it's work in progress in terms of this. It tells you one thing, it doesn't give you the reasons what the difference it's going to make, because we've only just opened Tremaglin and we haven't actually taken anybody in yet. So it's work that will be in progress that you will see the results, hopefully, fingers crossed, later on during the year.
Do you have any timeline, Angela, on obviously when you start taking in on Tremaglin?
Yeah, the painting and decorators are in at the moment. The beds are about to be delivered. There's just a few things happening. We've got a meeting tomorrow with health just to iron out the OT support into reablement. So yeah, it should be in the coming weeks before people start entering Tremaglin.
Okay, great. Ailey, have you got any questions more on Tremaglin now, obviously, because we've touched on the subject there for Angela?
No, nothing. It's just great to hear that you know, everything's moving, and hopefully within the next couple of weeks now, like you said, we'll see patients getting in there. So that's great news. Thanks, Angela, for the update.
Thank you.
Great. Chris Williams had a question on Measure 4, the number of people in care homes, and he wanted to ask, are there many waiting at the moment for care home placements in the borough? And also he wanted to know about how many places are out of county into Port Talbot, and how many out of county outside of Port Talbot. Have I actually said that one right there? Because do you know what? I'm reading my own notes and I was getting confused myself. But Angela, do you know what I mean?
I do, and I'll attempt to answer it. So there isn't a waiting list per se, other than people waiting for a home of choice. That is largely the waiting list, where people are choosing where they want to go, so they will hang on until such time. The issue for Neath Port Talbot at the moment is the lack of dementia nursing beds. So we have one home which is currently embargoed to take any new placements. So for dementia nursing, we tend to have to go to Swansea, Bridgend and Powys. We're not talking huge numbers, but obviously dementia nursing is becoming a big issue. And just for committee, with the new Hollins, I don't like to say that, but the new owner of the Hollins, whatever it's going to be called, we are in discussions with that provider about whether they will provide that form of care for us in the future, because that is the biggest gap for adult services, is dementia nursing.
And is there a big difference on price if it's out of county compared to if it's within county?
It can be, but all care homes now are asking for a top-up fee. But I can give you an example of one in Bridgend where it's £200 per week over the going rate. Top up, yeah.
How are people actually paying for this?
It's a good question. Families will often say, I can't afford it.
What happens then?
The local authority picks it up. In fact, I asked Audit last year to do a piece of work on this to see exactly, you know, what providers will tell us is you're not paying us enough money. The basic rate you're paying us isn't enough, and therefore we're having to put a top-up fee on top. There is work ongoing on a national basis, and I know Hayley Short from our commissioning end of the world is talking about a national commissioning, so that, you know, we won't get to a point where we pay all care homes the same rate. But there is that open book exercise that people don't necessarily engage with as well as they should when determining fees. That's what I mean, Chair.
Yeah, thank you for that. That's interesting, that is. I think that is something that obviously we'll keep an eye on going forward as well, because again, that especially comes in with the budget as well.
Yeah, it's at the forefront. Yeah.
Yeah, great, thank you. And just bear with me. I think that's it. Yeah, that's all that on that one. Again, this report is for monitoring only. So I'll go straight on to agenda item 7. I have no urgent items. Oh, sorry. Councillor Lockyer?
Yeah, sorry, Chair. It was just on Measure 5, the number of children, which is a great number. I can see that is coming down nicely. But what would that number look like if we included the unaccompanied asylum-seeking children?
That's on page 101. Sorry,
yeah, at the moment, it's excluded. The figures show the exclusion of unaccompanied asylum-seeking children. I just wondered what it would look like if it actually included it as well.
Wouldn't see that. Chris?
Oh, Ian's beaten me to it, Councillor.
All right.
Yeah, Councillor Rock, that would be an additional 19.
Oh, thanks. Right. Okay. So it's not a massive figure then, really, by country standards. That's good. Yeah.
No, it's not. No.
Yeah. Thanks very much, Ian. Thanks.
That's okay.
Okay, thank you. Thank you for that. And you did say 19, not 90, didn't you?
I did, yes.
Okay,
Just
great.
19.
The sound is quite low on the screen today as well, isn't it? So we're struggling to hear sometimes. Right, okay. So agenda item 7, I have no urgent items. Agenda item 8, we will now need to consider the private items included on the agenda. As you can see on the agenda, the private paragraph is there for everyone to read. Can I will propose, can I have a seconder, please?
Second.
Move into private.
I'll second.
Can I please ask that any public or press in attendance now exit the meeting, and can the recording be stopped?